Community and Public Health by Angela Hernandez. March 16th, 2015, Professor Brandy Merriweather. Role of Public Health. What is public health? It began as a workforce consisting of physicians, nurses, and biological scientists employed to address public health needs such as sanitation, infectious diseases, immunizations, and food and water quality. However, current public health challenges include environmental disasters, health equity, technological advances, effects of globalization, and the impacts of an aging and increasingly diverse society. Changes in the way the program is run and the requirements to become a doctor in public health is becoming more intensive and more prerequisites are required, like 2 years experience in the public health sector prior to becoming a doctor in the field. Public health aims to help the community or general population live longer, curb the infectious disease rate, and promote general health. The Institute of Medicine recently noted that there is little evidence concerning any structure or operations of the public health delivery system. It is also mentioned that policymakers and administrators have little information to go off of to make informed decisions or to distribute the public health to the public health sector. How can this be when the public is the one in need? The public healthcare system that we have now is to serve the vulnerable populations of the elderly, the disabled, the poor, and children through programs such as Medicare, Medicaid, Title V Title V maternal and child health services, Children's Health Insurance Program, state health insurance programs, school health programs, supplemental food programs for children and the elderly, public health immunization and health services, federally qualified health care providers, and Indian health services. What funds all these, do you ask? The federal government is the one funding the public health. There needs to be more structure, or we will continue to spiral down into bankruptcy. Of course, there are ethical issues in public health, such as immunizations. Should they be mandated? This gives up the right of freedom of choice to parents. The responsibilities of these vaccines, and for parents to ensure their children are vaccinated, are to prevent diseases that can be prevented and have been wiped out and the like. And people need to make their choices appropriately. Ethically speaking, certain behaviors are restricted, such as drinking and driving. This was mandated into a law for the safety of public health and community health as a whole. Certain laws in our country's history have been geared toward the healthcare industry. Civil Rights Act, for instance. Not only was this for equality for race, but also equality to receive medical care at any hospital setting. Funding. An estimated 8.5% of Medicare and 11.8% of Medicaid spending is attributable to obesity. The government must address poor nutrition and obesity as a public health crisis, but also as a major drain on the country's finances. This is an outrage that poor nutrition and people's unhealthy choices affect our country's finances so much. In 2009, only 3.1% of the total government spending on health was dedicated to population-based or public health efforts. The Institute of Medicine analyzed the financial challenges facing the governmental public health infrastructure and found that public health was both insufficiently and dysfunctionally funded. Communication. The public valued high glamour genetics and high technology biomedicine over basic prevention and population-based services, and the legislator has neglected the legal foundations of public health. The law lacks coherent vision of an appropriate mission, essential services, powers, and safeguards for public health agencies. This is poor communication when it comes to planning for the funding of public health. The programs that the public health funds, such as the Food and Drug Administration, the Centers for Disease and Control, Department of Homeland Security, and Federal Emergency Management Agency, all base communication as a core value. This is necessary for the programs to thrive and survive. If communication was not a factor, How would the local chapter let the state or federal government know that they needed help? How would anyone know that they needed more tests or that they even had cancer? How would we get a doctor to help us if we couldn't communicate to the problem at hand? Communication is a basic human need. It is how we express ourselves or let people know what we need. It is essential in the public health department. Public health is all of these things. Without it, we would be very sick.